When children have urine accidents in school, teams must work to determine the reason for the behavior. Initially, rule out any physiological reasons for this behavior by consulting with your child's pediatrician. If physiological reasons have been ruled out, it is then important to determine the reason or function of this behavior. Does the behavior help the child avoid a non-preferred activity? Is the child seeking attention or trying to communicate something? Work with your team to track the occurrence of accidents on an ABC chart to determine if the behavior is avoidance, attention-seeking, or for communicative intent. If the behavior is determined to be avoidance of academic tasks, the team may explore a number of strategies. When work appears to be overwhelming, chunking is a visual support that can make work appear doable. Here are 2 examples of chunking. An intervention that can help a student be more receptive to completing non-preferred activities is called Build Your Own Schedule. This strategy allows the student to choose the order of the task to be completed, giving control over the sequence of activities. Provide the student with 3 task options and have her place them in order of preference, with pictures or by writing. Next, have her choose a preferred activity and write it in the space. If the behavior is determined to be attention-seeking, all adults working with the child must be very careful of their responses. If an accident occurs, a cleanup routine should be established with verbalizations kept to a minimum. If the behavior is determined to be related to communication, work with the speech therapist to be sure the child has a way to communicate his needs, anger, and frustration. Establish a regular, consistent daily bathroom schedule for home and school. Chart the results of the child's bathroom visits, specifically successes, for a minimum of 3 days. This information can be used to determine how often he should have a bathroom break on a regular basis. For additional resources and printables, visit thewatsoninstitute.org.